People, we have to understand that our success as an owner is completely tied to the success of the associate. Because I can't grow a business if it's reliant on me to be there and to me to be the one working.
Welcome back to the Millennial Dentist Podcast, a podcast all about working smarter, not harder. Pushing dentists to go beyond dental school dentistry and build the practice of your dreams. Here is your host, the Millennial Dentist himself, Dr. Sully Sullivan.
Hello? Are you there? I like that song from Adele. Hello? Welcome back to the Millennial Dentist Podcast, everybody. I hope you're having a fantastic day out there, staying safe, just living the dream. I don't know about you, but I'm excited. Spring is here, or it's around the corner, depending on what country, part of the country or world you live in. I guess it's not if you're below the equator, but that's a little too much semantics for me. I'm excited about this episode. Today, we're going to jump into some kind of just interesting discussions. The scheduling conversations we've had over the last couple of episodes have brought forth some good follow-up questions via the Instagram. So I'm gonna talk about some of these questions that we've gotten over the last couple weeks, and I'm gonna read them out loud. So if you send me DMs, you may become a podcast episode. That's what's happening here. But anyways, before I dive into that, what I want to tell you is I'm super excited about our 3D Growth Summit coming up in May 2nd and 3rd. Great news. If you can't come because it's sold out, you can get online access now. So we will be live streaming that event May 2nd and 3rd for, I believe, $399, like just $399. Like that's a deal and a half. So, reach out to us at 3D Dentists. You can email Meredith at 3d-dentist.com if you want more information on that. And I'm sure she'll be happy to get you signed up for a live stream. You'll be able to ask questions, be engaged, be involved, and you'll get, I believe, a copy of the recording as well. All right, so let's going to jump into this. So Connor, thanks Connor, you're an avid listener, and he reaches out to me all the time. He needs to do Mastermind, but that's neither here nor there. He said, hey, just listen to episode 145. I'm curious, do you guys use EFTAs? So we're going to jump into that part of the question first, because I think that's a really good follow-up conversation to how do I use EFTAs, because we do have EFTAs. We have, I think, 3 EFTAs in our practice, but we use them a little differently than the traditional sense. Now, if y'all remember back to an earlier episode that talks about one doctor, one column, you'll remember that the mindset is this value of an operatory is that if I'm a dentist and I work 2 operatories, really what you have to do is divide my production in half per operatory. So if I do $80,000, but I use 2 operatories, really I do $40,000 per operatory. As a business owner, what I would rather do is have providers in each operatory so that there's more production being done. Now, what that may do to the individual dentist is lower their production a little. So instead of doing 80 between 2 columns, maybe you do 70 between 1 column. But I would rather have another dentist or another provider in that column doing more than your 40. So that's kind of at base value, kind of how that all comes to fruition. Now, EFTAs are kind of unique because a lot of people in the traditional sense, what they do is and again, dentists, and I'm going to have to use I got to get on the same lingo with you all as far as the verbiage here, in that owner dentists tend to look with their dentist hat. And what I mean by that is that most people, especially when you're a solo doc, try to maximize your efficiency or maximize your productivity, and therefore leveraging EFTAs to do part of your production is more efficient. If I can prep 4 teeth, you can fill them, I can go prep a crown. In theory, I'm being more productive because I'm doing more volume. Everybody on the same page with me? Now, the challenge with that is we're still minimizing the amount of production that can be done because now I'm occupying 2 chairs and they're both being tied up. So my production is still kind of getting divided across that way. Now, if you practice out of 1 chair, then all of a sudden this question of do I need an EFTA or not kind of then becomes an interesting take or point, because now if I utilize my EFTA to do the fillings and I don't necessarily have a chair to go to, is it more productive? Now, what I would tell you is yes, it is. You're just not going in their chair. I have other things that I would like you to go do. So what we do is we operate one doctor, one chair from the top down. Myself, all the way down to all of our associates. Now, what my general associates do, who leverage our EFTAs to do fillings, what they do is that's their opportunity to either go do hygiene checks, where now they can do good hygiene checks, because good hygiene checks ultimately set up for fewer well-planned visits. Because remember, the whole reason that one column works in our office is because we do more dentistry on fewer people. And so we do a lot of quadrant or multiple quadrants and that type of dentistry. We do a lot of sedation. And so the whole point of this is that I need to have good, adequate time to diagnose, because it's like a cycle. And what happens is if you diagnose in single tooth dentistry, guess what gets on your schedule? Single tooth dentistry. And this goes back to if you diagnose with intraoral cameras, which are single tooth cameras, then you get case acceptance for single teeth, and then you get scheduled single teeth, which it just perpetuates this cycle. And then if you're running back and forth between two columns, then how much time do you have to go and do a good, adequate hygiene check that could potentially take 7 to 10 minutes to close actual dentistry? It's impossible. So this cyclical effect of leveraging EFTA to just increase our efficiency to run like you're a hamster on a wheel and you're just using it to run faster, has a limit of its potential. It's self-limiting, I guess, would be another way to say it. Now, so they leverage it for hygiene checks. They also land it for what we call planning appointments. Now, planning visits is what I'm specifically talking about at the summit, so I don't want to give too much information away, but I'm really excited about my talk because to me, one of the gateways or keys to what makes us successful in our treatment planning and fewer well-planned visits is because we create a lot of consults from our hygiene base. Patient comes in, we go through our workup, we realize that, hey, in order to adequately treatment plan and go through things with you, I can't do that in 5 minutes. If you've got 2 crowns potentially, a couple fillings, a missing tooth, and maybe you're interested in cosmetics, I can't have that conversation in 3 minutes. Nor is my team ready to go through the financials and the logistics of what that would look like to get scheduled. So naturally what we do is we just check things down to get started, and that creates the cyclical thing. So what my mentality is let's slow down to speed up. Instead of trying to sell you dentistry that day, what I'm really just trying to sell you is, hey, Mrs. Jones, there's a lot going on. We've talked about a number of different things today. Would it be okay if you'd be willing to come back to our office within the next week, sit down with me and one of our treatment coordinators to come up with a personalized plan and go through all the logistics so that you know exactly what it's going to cost, how long it's going to take, and what we're going to do before we get started. Would that work for you? And so we bring those patients back. So naturally what that means is I've got to have time on my schedule to then do those glorified, because those are great hygiene checks, right? Because I call it a hygiene check, but it's a patient coming back for a consult, but they've already got everything. So it's like either just a consult or glorified hygiene check, because I'm just going to go in there and present the dentistry that I would have presented that day had I had the adequate time to do it, if that makes sense. And so what our associates do, they do this so well, is they will leverage that time where they've got maybe an hour appointment with 2 fillings or 3 fillings. So that first 20 minutes, whenever they're prepping, then they can leave, they can go do their hygiene checks, and then they may jump into a consult room and do the planning appointment that's been brought back from a hygiene visit a couple days ago, and have the time to present good quality, fewer well-planned visit dentistry where there's a couple things that are happening. One, the patient knows they're getting sold something because they're coming back. Like, that's a great mindset for them to be in. 2, we are not rushed because we've built in time, because we're now leveraging the EFTA to give us some free time to go do this. And it's not taking up our production column. It's in a different column with the treatment coordinator, because it's a whole other topic for our day that I believe in the treatment coordinator should have a dedicated column. And then the third part is our treatment coordinator and our front office team is now financially ready to close the case, because we're aware. We make sure we know what their insurance is, we know what their benefits are, we know what the treatment plan could potentially be, so that everybody's on the same page to maximize the potential for success, and the patient saying, yes, I want to do more comprehensive dentistry and fewer well-planned visits. By the way, if you're not watching on YouTube, go check this out on YouTube. It's a video, the whole 9 yards now. I need to watch it there. And subscribe and like and all those things. All right, so that's kind of my take on EFTAs. Is I love EFTAs. We use them. We just don't use them in the traditional sense to maximize my dentist efficiency in the traditional sense of the word. It makes me more efficient, by the way, because I can go do this. I'm just using it not to go do more hamster wheeling, but to go sell and close fewer well-planned visits, or to sit down and design surgical guides or check on my lab stuff. Like that is good built-in time that I like to have. So we go on to say, okay, well, I think I found an associate to come in, blah, 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 blah. I'm not going to get all these details out. So now I'm trying to dial in the schedule to make it all work. I'm considering cutting back from 5 days to 4 days just because just so we stay busy. I'm currently booked out 3 weeks, 0 opportunity to bring in someone for a crown or an implant unless I do Saturdays, blah, which I do sometimes if the dollar makes sense. Now, it was funny. I spoke in Montana last week to a group of Alabama dentists. There were dentists from other places, but most of them were from Alabama. It was the Alabama Dental Association, which, by the way, plug to them. If you want to go to Big Sky, Montana and spring ski, which I love to do, I've been there a number of years, they put on a great little meeting, Big Sky, Montana, every spring break. You check it out, Alabama Dental Association. They have a website, I'm sure. And it's not expensive, but some good CE. That's not while you ski. There's a bunch of us to go. Check it out next year. So I'm talking there and we're talking about this kind of conversation about scheduling and whatnot. And it comes up that this kind of same point about everybody walks right into my trap. I said, okay, you got a patient and this patient, they come into your office, they've got $12,000 and they want to do 8 anterior crowns. How quickly can you get them in? I said, raise your hand if you can get them in the next day. And like everybody raised their hands. And I was like, perfect. Tell me how you get them in. They're like, well, I'll just move patients. I'm like, oh, that's a great experience for those other patients. Oh, I'll work through lunch. That's a great, I'm sure your team will love that. We'll stay late. I'm sure your team's family and your family will love that. Or I'll come in on daggum Saturdays, Connor. Like, come on. I love it. But there's a dollar amount that makes sense. My question always is like, where is the tipping point? Is it $5,000? Is it $4,000? So it's $44,999. It doesn't make sense to come in, but if it's $5,000, it does. Oh my gosh. Because what none of us do to the appropriate amount is we don't block our schedule or prioritize our schedule for larger type stuff. So I got no opportunity to do an implant for 3 weeks. Now, a lot of you, that's even further out than that. And the challenge is what I will tell you is some of you are like, well, I could see them next week because my schedule's wide open. You still got to start prioritizing and blocking this because Lord willing, it won't always be that way. And I guarantee you every dentist that looks now and says, gosh, I'm booked out 5 months, 3 months, 6 weeks, they didn't start that way either, but they didn't build things on the right foundations. And it's way harder to unwind things than it is to start them up the right way. So those of you that have the availability right now, it's even more critical that you start to prioritize and put in blocks into your schedule so that when the time comes that you do start to get busy, you don't have to just backtrack and retrain your team, retrain everything in that regard. So to me, what that tells me is you don't have enough blocks. You don't have enough bigger priority blocks if we're having to do that. Now, I also want to point out that the goal when you bring in an associate is to ramp up, to push out as far as possible by prioritizing what you want to do and kicking out what they want to do. Or, excuse me, a better word would say what they can do. Because typically in most, it does vary, but most owner-associate relationships, the owner has a higher skill set. Most owners don't like to hire associates to do something that they can't do. Like they want to overhire. Now there's some instances where this makes sense. Like if you're a dentist who doesn't want to do surgery, you're very clear on that, but you want to hire someone, like they may hire someone to bring them in for that. But most situations, what we see and what we preach is that the owner dentist continues to grow their skill set. They move beyond dental school dentistry, meaning the dentistry that you learn in dental school. The associate comes in either out of school or maybe with 1 or 2 years experience. And I'm speaking to the mass here. So I get that there are other examples or scenarios. even if they've been further out, they're still maybe from a skill set standpoint, a menu of services standpoint, they're still pretty green, meaning they only offer services that are primarily taught in dental school, fillings, crowns, root canals, dentures, maybe some minor ortho, maybe some minor extracting, grafting. But a relatively standard skill set. So then what happens is as the owner doctor, what I want to do is I want to start priority blocking my schedule for larger time blocks, so larger cases, and more specialty type procedures so that I can see you next week for an implant or tomorrow for an implant, but I can't see you 8 weeks for 2 MODs. I can't see you 4 weeks for a single crown, but I can see you in 2 weeks for 3 crowns. And now what's the delineation there? Well, you're like, well, the question should be, well, how do you schedule that on your schedule? Well, because the delineation is not procedural there, it's time specific. This is stuff we dive so deep in the mastermind programs on, because these are just core fundamentals. So we start with time specific so that I know, okay, well, I've got a 3-hour block. Well, that's not a 1-hour crown. That's going to be multiple crowns. So I'm prioritizing a 3-hour chunk of time. And then I know that my next 2-hour chunk of time or 1-hour chunk of time isn't till further down the road. Naturally, what we know is that the dentistry that goes into 1 and 2-hour blocks is typically more basic dentistry. Now, it may be booked longer for an associate, but the time relativeness of the type of dentistry is still pretty much the same. So then what happens is so now you're booked out further, which is great, so that when the associate comes in, now all of a sudden we have all this dentistry that we can pull forward and up because it's dentistry that they can do. But if you just let your schedule be like it is now, which is free reign, then you're doing dentistry that they can do, and you're pushing out dentistry that when they get here they can't do, and you can't bring up for them to do because they can't do it. That's problematic. So I'm not an advocate of working Saturdays. I am an advocate of ramping up my diagnosis and my treatment planning so that I can book out dentistry so that I have a book of business for them to walk into. Absolutely. This associate wants to make $180,000 a year. I'd say that's a pretty normal number. They want to start at $700 a day or 35% of collections. That's what other offers have looked like. She sees our practice, sees the value we can offer, what I can teach her. Where would you come in at an offer? Well, it sounds like the offer pretty much is what it is. Now this is like always, and this is a great question because so many of you have this question. The question on some level is irrelevant. It's irrelevant, especially the daily guarantee part, because if you do this correctly, what I'll tell you is that the daily guarantee should never be a problem. Meaning if you treatment plan like we want to treatment plan, if you block like we want to block and communicate we want to communicate, and you've leveled up your skill set to be able to start taking things off your menu, then getting to $700 a day is really no big deal. I mean, now I like to use, we can use 35% of collections. That's fine. 30% of adjusted production is the other number I like to use. But if we say 30% of adjusted production, because that's what I'm used to using, that means that they need to do, it's $2,100 a day, right? 700 divided by 0.3 is $2,300 a day. So that means all they have to do to cover their base at $700 a day is $2,300. Now, if you think about where that can come from crowns, fillings, exams, radiographs on their side of the deal. That's not hard to get to. I mean, $2,300 a day, even in like a PPO practice, that's like if your crown's $800, that's like 2 crowns and a couple fillings, not even counting the exams and stuff like that. So what I'll tell you is it should be relatively easy to break even that number. And what we also know is that daily rates to me is a 6-month guarantee. Daily rates are a 6-month guarantee. At that point, you move to the same way I get paid, which is I don't get paid unless I produce. So I don't want you to lose somebody off a daily rate by trying to undercut someone to be 600 or 700 because it doesn't even matter. It's irrelevant a couple months anyways. And again, if you do it appropriately, you should know that that's not even a hard number to hit. Now, the number that's probably a little more worth negotiating is your percentage number, just because that's a forever number, right? And you can't go backwards from that. Now, what I tell every dentist that works with us, especially in our advanced program, because we work with a lot of people that bring in a lot of associates, is what we've got to sell is this message to the associates is not that the percentage is irrelevant to them, not to us. It matters because you're going to pay that out. To them, it doesn't matter, and it matters a little bit to them. But here's why it doesn't matter. Would you rather, as an associate, get paid 30% of $1 million or 35% of $500,000? Now, let me do the math for you. 30% of $1 million is $300,000. I can do that. 500,000. Let's do even 600,000. 600,000 times 0.35 is 210 grand. So with a higher percentage and less production, you make less money. Now, there's obviously a break even that we can get there, but the point is that if I'm a young dentist, I would rather have more reps and know that I'm going to be fed in a practice that wants to me succeed, and there's going to be an endless opportunity to stay busy and produce and work. I'm not going to have to fight for my cup of tea, especially when it comes to like the dental school dentistry procedures. And that's which, by the way, you have to earn your stripes if you're an associate listening to this. Like, you don't just get to walk in and do all in fours. Like, that shit doesn't happen. If you want to just walk in and do that, go do it on your own. I will gladly let my associates grow into that, but you're gonna have it took hard work and hustle and whatever to get to where I get to do what I do now. Like, I grinded through some of that stuff. So I'm all good. And look, at the end of the day, like, what I preach to associates is, do you think I want my associates doing fillings or implants? Like, which one makes me more money as a business owner? We're all in this together, by the way. Like, it is a win-win relationship. There's just a timing in place that has to come in to make this work. And so what my pitch to my associates is, I'm not going to guarantee maybe the highest percentage, but what I will guarantee you is you will be busy and you will have a success path to do the dentistry that you want to do. And I will not get in your way of doing it, because I will keep leveling up my clinical skill set to where you can't do what I do. And if you can't do what I do, then I don't have to worry about you wanting to do it. And then at some point, if you learn to do what I want to do, guess what I'll do? I'll just go get more of it to support both of us. Because why would I want to have a limiting scarcity mindset that says there's only so many implants to go around and so you can't do them? Like, that makes no sense, but it needs to come in due time. So that is my pitch, and that is a compelling pitch, by the way. Like what I just said, how would you not want to come work for that? You get to work with the best technology. You have a pathway to success to do the dentistry that you want to do. You will be busy, you will be fed, and I will mentor you along the way as long as you're willing to put in the work. You will never have to worry about your schedule not being filled. It is my priority to get your schedule filled. Well, who checks the new patients? It doesn't matter. Hopefully I check all of them because I'm going to give you all the dentistry. That's a compelling message, and we need to start changing the narrative. And I'm telling you, associates are going to look at you and look, here's my other caveat to you owners. You can't judge these dentists that come out and they ask these specific questions because they know no better. Because the majority of dentists out there do not treat people like that. They do look at them as, you're going to do this shit I don't want to do, and I'm going to do what I want to do, and there's no pathway to success. You're just a worker bee. And so it's a fair question for them to want to ask new patients, because those of us that are hearing what I'm saying, we are the outlier to the equation. So don't, because I've been quick to want to judge and be like, oh, I don't want that person to work for me because they don't have the right mindset. No, they don't. It's just they don't know any different, and because that's what the world has trained their mindset to be. It doesn't mean they're actually that way. I don't know if I actually answered the question or not, but I felt like that was worthwhile. All right, we're going to wrap up here pretty soon. Last little bit. I'm taking the risk on my patient base that I built, and as you said, I take all the risk and see little reward at the beginning with an associate. Let me be very clear. We have to understand that our success as an owner is completely tied to the success of the associate. Because I can't grow a business if it's reliant on me to be there and to me to be the one working. If I am the most productive employee in the business, that's not a business. And yes, early on, you may not make a lot of money directly off of them. It's kind of like hygiene to me. I don't make a lot of money off the hygienist production, but what I do make a lot of money on is what comes out of the hygienist chair. And what I'll tell you is the associate's not much different. An associate doesn't make you a lot of money, but what they do is they finally clear up your schedule because you won't priority block it to do more of the dentistry that is productive and that you want to do, and that is where you make the money. I don't make money off associates doing fillings and crowns and even single implants, really. I make money knowing I don't have to go do fillings, crowns, and single implants. That is where the true value comes from. My objective for having an associate is to grow the practice while at the same time removing pebble dentistry off my schedule, focusing on larger treatment plans, allowing me to take a week vacation if I wanted to, which I've never done since I started working 3 years ago. Man, that story is so common. So kudos to you and good for you. And I do think you're understanding the value, and that it's about, removing more of the pebbles off your schedule, because if your schedule is only full of rocks or boulders, then naturally you can work less and be as productive as when it was filled with all the other stuff. That kind of ties back into the scheduling conversations we've had over the last couple weeks. I'm going to schedule tear right now. Schedule tear, y'all, right now. I hope you enjoy this episode. Keep the feedback coming. I'm serious. I like getting comments and messages like this, because it just helps me get good content to talk about and whatnot. So I appreciate that. So please keep those coming. If you like the podcast, please go on iTunes, like it, subscribe it, share with your friends. Yeah, check us out at 3ddentist.com. Oh, I do want to plug one more thing. Just tomorrow, March 29th, crown lengthening online course comes out. So if you're interested in crown lengthening, you like, hey, I've always wanted to do crown lengthening. We got an online course. We used to do it in person, but I'm just too busy, so we recorded it online. It's 3 hours of content, 3 live surgeries are in there, recorded and voiced over, where we talk about the surgeries. Reach out to Meredith at 3d-dentist.com. She can get you signed up for that. Check it out. Otherwise, I hope you have a great day, great rest of your week. Gosh, what a good profession. I love it. Work smarter, not harder. We'll see you next time.
Thank you for listening to The Millennial Dentist. Visit us online at millennialdentist.com.